He was a breast surgeon working at both NHS and private hospitals in the West Midlands. He's currently serving a 20-year jail term after being convicted of wounding with intent. More than 750 of his victims have been compensated, but 11,000 women were operated on by Ian Paterson over many, many years, despite the fact that it turns out that he was sometimes operating on women who didn't have cancer, including giving them full mastectomies, but also he was carrying out in his private work operations which were totally unverifiable and unregulated, where to allow women to keep some of their cleavage, would you believe, he was basically not removing all of the cancerous tissue, leading a number of those women to go on to die of their cancer. Well, thousands of women could have been spared from being maimed at the hands of the doctor if it was not for what the man carrying out the inquiry into his work, Right Reverend Graham James, has called willful blindness by fellow medics. In his independent inquiry, he found that numerous people had raised concerns and yet nothing was done. And as a result of that inquiry, 3 doctors have now been referred to the General Medical Council, 2 nurses referred to the Nursing and Midwifery Council, and 1 has also been referred to the police. Well, let's talk about this with Tracy Smith. She is one of Ian Paterson's victims, and she kindly joins us now. Good morning to you, Tracy.
Good morning.
This story is extraordinary, and the fact that it has happened is so recently. We're not talking about something happening in the 1950s, but it's something that's happened incredibly recently. Now, tell us what happened to you. Tell us your story and what Ian Paterson did to you.
I went to see Ian Paterson in December of 2008 as a private patient. I found a lump in my left breast. Once I'd seen him, he did a mammogram and a scan. He didn't do a biopsy. Went out of the room, had the test, came back. He said, it's sinister. You have cancer, it needs to come out. It could spread. It will be a wide local incision that you will have under general anaesthetic. Within days, I was in surgery. And when I came round, I had very little. There was a massive difference between my left and my right side. And on questioning that, he said, it was much worse than we thought. And we've just had to take more to be, as a precaution. It went on in and out, having scans and checkups. And then in 2012, I was recalled to be told that West Midlands Police had wanted to speak to me as Ian Paterson was under investigation. I never had cancer, I only had a 2-centimetre cyst. And
he removed basically 3/4 of one of your breasts?
Yes, 3/4 from the left side.
Tracy, it is absolutely extraordinary what happens. So people like you having operations that you didn't need, and other women who didn't have as extensive a mastectomy as they did need, not removing all of the tissue, and therefore we know a number of those have gone on to die. What are your feelings towards Ian Paterson right now? He's serving time behind bars, 20 years, in my view, not enough, but what are your feelings towards him?
He's never, ever given any reason or apology, even through the trial. He still stood in the dock and was in denial. Up until last night, he's in denial. He's made a press announcement to say that he's appealing his sentence. Well, you've had 2 years to do that. Why do you have to announce that yesterday? And it's like a constant game with him.
Do you think it's we've heard a lot about some, particularly consultants, a God complex, that he just sort of somehow thought he could play God with women and their bodies?
I've always said he liked to, with regards to the non-cancer patients, he liked to tell you you've got cancer, he'll give you cancer, but he'd like to tell you that he saved you and taken it away.
So he's the saviour.
Yeah.
And of course, the big issue that's been raised by Right Reverend Graham James, the inquiry chairman, and I have to say, I do think he's done a fantastic job and has really spoken out on behalf of you're not a patient of Ian Paterson, you're a victim of a criminal. And the key thing he's pointed out is the willful blindness, that was his words, by fellow medics. And we know some people were raising concerns. Lots of those people then went on to be investigated themselves. But people raised concerns, and again it would appear that the hospital authorities, both in the NHS and in the private hospital he was working in, didn't want to have a recall of all the patients. They didn't want to go public with this. They didn't want to take any action because they thought it would be bad for the reputation of their trust, which absolutely defies belief. It seems to me a lot of those people should probably be in jail as well.
Exactly. We've said when we were giving our evidence to the inquiry that Ian Paterson was not one on his own. There was other people that could see what Ian Paterson was doing regarding the cleavage sparing and leaving too much tissue. Also, there was oncologists, there was people in the labs that was sending over negative results, and then he was going on to remove healthy breasts. And a lot of it, they just left him to it, because in the private sector, there was no multidisciplinary team meetings as there should be, where you've got a team of people that look after your care. Ian Paterson and one breast cancer nurse were just allowed to continue, and until we're now looking at, in the private sector, he operated on 6,617 people, which was more than any other doctor.
Yeah. Which suggests something was going wrong.
What the red flag?
Yeah. Well, what the inquiry chairman Graham James had to said, he said some medics who work with him must have known about his apparent clinical practice, yet allowed to continue. He said this would be tragic enough if it was simply about a rogue surgeon, but it is much more than that. It's the story of a healthcare system which has proved itself dysfunctional at almost every level when it came to keeping patients safe, and where those who were the victims of Paterson's malpractice were let down time and again. Opportunities to stop him were missed at time after time. Once action was finally taken, patients were let down again by wholly inadequate recall procedures in both the NHS and private sector. He says, my report sets out what can only be described as willful blindness in relation to his behaviour. He says colleagues avoided or worked around him. Some could have known, while others should have known, and a few must have known. And this is the big issue. You see, one of the things he did say at his press conference yesterday, the Reverend, was that there's all the evidence he's taken suggests to him that this could happen again. It could be happening again right now. It could happen again in the future. We haven't got the procedures in place and the attitudes of the staff in place to stop it from happening again. What do you say to that?
We've said all along to the inquiry that Ian Paterson is not the only person. Just a couple of weeks ago, it transpired there's another surgeon under investigation at the same hospital at Spire for unnecessary surgeries on arms. We have said all along, if you go into a private hospital and you've got medical insurance, you must ask for a second opinion when they're saying, oh, you need to have this procedure or that procedure, because you're an open checkbook.
Yeah.
And that's what we need to make sure that that what's been advised to be put in place now is put in place quickly and monitored and not just ignored.
Yeah, indeed. And of course, these surgeons, many of them working in the healthcare service, in the private healthcare, they get their patients via those referrals through the NHS. And of course, you look up, you look up who the surgeon is. Oh, he's an NHS consultant. Oh, well, in that case, he must be kosher. He must be all right. So we had a total failure. What do you want to change? What do you think will make a difference and will save other women from going through what you and another 11,000 patients have gone through?
In the private sector, my GP would not have had access on the computer to any of my notes. If I had been an NHS patient, she could have gone onto my notes and checked. With the private sector, she couldn't do that. So all she got was letters from Ian Paterson telling her what was wrong with me. I want it so that GPs can access your notes in the private sector and actually look at what tests you've had and what the results were, and should you be having the treatment that you're having. That needs to be in place, because many people would have been saved from further surgery had GPs been able to see what was going on, other than a letter off Ian Paterson saying your patient has cancer. She only knows what he's telling us.
Yeah, it's absolutely extraordinary, isn't it? Well, we'll be talking to the Health Secretary, Matt Hancock, later on. Anything in particular you want me to say to him or ask him?
I think we've just about covered it all now. We just wait for the coroner. For the coroner's investigation, it's always been important from when we campaigned for the inquiry. Once we get the inquiry, to convince the inquiry that we need the coroner involved. 675 people in the NHS sector lost their lives up until 2017. More have died since. The private sector will give us the statistics on the operations that he did, but they refused to tell us how many people died.
Yeah, it's absolutely extraordinary. And certainly a lot of people talking about Ian Paterson needing to face manslaughter. I would say murder charges. I really think we need to stress this. And as accomplices, if you stood by and saw it happening, you did nothing, I don't know how you've not committed a criminal offence. Tracy Smith, you're very brave to speak out and campaign on this. And I really appreciate you taking the time to talk to us here at Talk Radio, one of Ian Paterson's many thousands of victims. It's coming